And since we reached quorum, the meeting shall begin now. So can the Secretariat invite the administration officials and the deputations into the conference room. At the July meeting, we have agreed to invite the members of the public to attend this meeting. For the Bills Committee on the Dutiable Commodities Amendment Bill to express wish, we have received 8 replies to attend today's meeting. And we shall follow the order as stated in the list in asking the deputations to state their case. And on the table, there are submissions for your references, including the deputations who are present today and those who are not. And for the 8 deputations today, your speaking slot is limited to 3 minutes. And may I remind the deputations that the timer will sound at 3 minutes to signal that your time is up. And you're welcome to submit your submissions after the meeting. And for those you submitted prior, we have already received them. And please take note that the version in front of you, while the voice on the floor is 0 on the speakers. For those who require interpretation, 1 is the Cantonese version, channel number 2 is the English, and channel number 3 is Putonghua. And please turn on the microphone when you speak. For the sake of our simultaneous interpreters, please speak in single language. And I would like to remind those present that your oral representations made in the meeting will not be covered by the protection and immunity provided under the Legislative Council Powers and Privileges Ordinance, Cat 382. And likewise for your written submissions. And the individuals or representatives of organizations are attending the meeting are invited to note the security measures set out in the note for the members attending meetings in the conference room or serving meetings in public galleries in the electrical complex. The note has already been tabled in your seats. And those in the public gallery can ask for the note from the staff. Can we first have Mr. Mkinwa of Lion Rock Institute? It's a Chinese traditional thinking that to feed without teaching is the father's fault. For the parents to instill the proper values is a responsibility as well as a valuable lesson in life. However, this proposed amendment to ban the sale and supply of liquor to those underage is to deprive the parents of the right to educate their children and will actually bring negative consequences. Is this amendment can really ban all minors from getting their hands on alcohol or to buy them? Today's online world, everyone can order alcohol on the smartphone or even order it for their home delivery, or asking for an older friend to buy at the convenience store where they're free to drink at home. So may I ask, can the bureaucrats actually stop this? So does that mean a mother asking the son to get the wet market to buy rice wine, that will be warrant for an arrest? In 1920s, due to the pressure of the women organization, the U.S. government had enact the prohibition order that led to the loss in tax revenue and led to a much booming of moonshine and speakeasy and smuggling. And after 13 years, the prohibition was revoked after. Hiking up the tobacco tax led to the smoking cigarettes, and this morning the system have only discovered 70,000 smoking cigarettes in Yaotong. And for this amendment, would lead to similar issues. The most severe cases, at least they could actually buy alcohol in the open. And after the amendment, you're forcing them to go to the dark cases and where they're free to buy moonshine or fake wines for the criminals, or able to organize alcohol parties in tempting the underage to take part, in which they will be heavily intoxicated and they're not able to be in control of their faculties or put up resistance. By then, even the parents or the outreach workers wouldn't be able to save them. Can the bureaucrats handle this sort of scenario? For if any case of unfortunate events, how can the public officials be held accountable for the consequences of this ban? And for the Juvenile Offenders Ordinance, the child referred to the anyone under age of 14, and young person is referring to anyone between 14 and 16. The legal age for sexual intercourse is 16 in Hong Kong. So I don't understand the bureaucracy claim that the underage as immature and so it needs to amendment. So does that mean that for someone who is 11:59 is 16 and in the next minute becoming 18 years old, it can become immediately mature and we're able to hold their liquor? So if they're able, your time is up, Mr. Ng. And you're free to supplement for your submission afterwards. Next, we have Civic Party, Mr. Lee Kaho. I'm Chairman, I'm Mr. Lee. In the year 2000, the government had instituted the liquor license system according to the Bill Committee and Dutiable Commodities. They stated the banning the drinking of the underage and licensed premises. However, it has a major loophole that only restricts the drinking in licensed premises. In other words, the underage, as long as they don't drink inside the premises, for example, they can buy in this restaurant or shops and drink outside the premises. There will be no supervision. Even though this retail store, like supermarkets, convenience store, had his own code of practice that would not sell to the minors. However, this is voluntary in nature, and even the selling to the underage, there will be no penalty or regulation whatsoever. So it's necessary to close this loophole. And this year, the Food and Government suggesting amending this law to forbidding the sale and supply of alcohol to anyone under 18. Suggests to cover the face-to-face and the remote distribution. In other words, it means in the future the minors were not able to purchase alcohol in convenience store, online store, and supermarkets. The Civic Party is supportive of this proposal. From the implementation, back in 1994, the Hong Kong government had banned the selling of tobacco to those under 18, which have been effective in the community. And currently, the shops have exercised self-discipline in refusing to sell alcohol to the underage. And this government proposed amendments for the frontline retail staff. There should not have any enforceability issues. And from the health perspective, starting drinking prematurely would affect the development of the children and adolescents. And as the alcohol, after absorbed in the human body, rely on the liver to detox, and yet the liver function had not to be fully developed in children or adolescents, and the drinking would lead to liver damage, and the alcohol would also affecting a different extent to the nervous system and the brain system. And you can see the children drinking is very harmful. And the Security Bureau survey in 2014-15, about 60% of adolescents between 15 and 16 had drunk, and over 20% of those underage has drunk before. Another Department of Health survey have demonstrated in 2016 that at least 3.4% of primary 4 students had engaged in binge drinking. So government must close this legal loophole to prevent children from drinking. In conclusion, the amendment would completely ban the sale of alcohol to underage teens. Is all but beneficial. A Civic Party is endorsing this amendment. Thank you. Civic Party, Mr. Ho. The Civic Party support the new regulatory regime in principle to ban the supply of mail to minors is very contradictory. A licensed premises is not able to sell alcohol to those in underage. However, they get bought easily in other locations, and these policies are self-contradicting. And like the legislation, as we must note, that once it enacted, the frontline retail staff is very difficult for them to enforce in some complicated areas such as Lan Kwai Fong or Mongkok. And if the patron looks of legal age, and when you check the ID and refuse, in these scenarios, the government shouldn't try to resolve the difficulty faced by frontline staff. And for the amendment, the burden should not be fallen on the frontline them. And shouldn't we have sanctions on the purchasers as well? And now, the remote distribution or online sale is quite easy, and shouldn't we give them the delivery person to the right to inspect the recipients or the purchasers, or whether through online or telephone system? Is there any way that we can confirm that the purchaser is of 18 years of age? I think the government should think clearly on how should we address this before implementing the law. As for the negative consequences of underage drinking, is quite well known. And if the government would like to achieve abstinence amongst the young generations, the approach probably not through legislation, is probably more on education and publicity, and putting more effort into it, and also work on the parents as well. I think the children drinking, besides the peer pressure, the first time in contact into alcohol could probably it happen at home or with family members. I hope the government should address this as well. And next, Ms. Zhang. In Hong Kong, for the licensed and licensed premises, for example, the retail shops and markets, they both sell alcohol alike. In this like regulations in like a regulation of selling alcohol to minors, shouldn't the government should do more regulation? And in terms of e-commerce, they're free to make an order or delivery online where alcohol can be bought easily. Should the government should set a barrier in control the electronic sale and distribution of alcohol? And instead of banning the sale of alcohol to minors, have the government set up some sort of an inspector in conferring them powers to enforce the regulations, so that this ban could be effective to achieving the desired effect of banning the sale of alcohol to minors. In Hong Kong, there are over 5,000 retail stores, such as bars and so on, with patrons of various qualities, and they're all in a different geographic or community. Should the government assign company officers to protect the parental officers and for their personal safety? And in order to reduce unnecessary conflict and to enhance the deterrent at the retail level, should the government set up publicity or maybe at the cashiers installing cameras, so that in case of dispute, there will be evidence that can be submitted to court, and in order to protect the frontline retail staff?
Because they can provide wording that they are being videotaped and it can act as a deterrent. So the government needs to provide standard procedure guidelines, and these clear guidelines should include the declaration of age on the internet, and for delivery personnel, if they have doubts, they should be allowed to check the identity. So in the long run, the government should consider the behavior of minors when they purchase alcohol and whether the shopkeepers and customers have to bear responsibility. In the UK, there are similar laws where the minors are penalized as well in order to add to the deterrent effect. Thank you. Next, Mr. Yip Man Ban. I am from DAB think tank Yip Man Ban. So minors are affected by peer pressure, so they get rowdy and they are susceptible to psychological and mental impairment. So the government amendment to plug the loophole in sale of alcohol to minors, the DAB agrees with the government, but we are concerned about specific operational procedures and the impact it will have on small businesses. So first, on the issue of remote distribution, you are aware that technology is very advanced and there are a lot of electronic retail platforms. So buyers, when they fill out the declaration, the government should provide standard forms or provide a technology for retailers and people selling alcohol to help them fill out the form. And we also want to achieve the purpose of our legislation. And regarding face-to-face distribution, we are concerned that small businesses already have a heavy workload. When customers patronize the convenience store, there is a long queue. And if you need to check proof of age, it would add to the workload and it would overwhelm staff, and it might even lead to disputes. So just relying on signage is not enough. The government should do more education. There should be more there should be more APIs, announcement of public interest, and we cannot just rely on intelligence to enforce the law. If there's a shortage of manpower, they should add more staff, and we also need to target cases that might arise out of the legislation. For example, when prohibition was implemented in the U.S. in the 1930s, we need to add more staff to deal with that. Now, regarding the plugging the loophole for where minors can purchase alcohol, we need to help them change their lifestyles, and that takes time. So, for example, you cannot enter the jockey club if you're under 18 and you need to produce proof of ID, so that's already ingrained. The government is taking the correct steps. It's just taking the first few steps. We also need to bear in mind WHO guidelines where they have proposals on how to minimize damage due to alcohol. For example, we also need health warnings for alcohol commercials, and we also need to declare that alcohol cannot be sold to minors. Next, Ms. Siu Ka-yan.
Director of a nonprofit here in Hong Kong called Kelly Support Group. We have been working with young people aged 14 to 24, particularly focusing on knowledge resistance and harm reduction around drug and alcohol misuse and providing education in schools. So as an organization that is doing this, we welcome all efforts that would protect young people from alcohol-related harm. Reducing the accessibility and implementing a legal age limit will bring about benefits to health and society. We can see that from overseas research in countries that have implemented the age restrictions, we have seen effectiveness in reducing overall amount of alcohol consumption amongst the youth. We have also seen alcohol-related traffic accidents and other long-term negative outcomes such as alcohol and other drug dependence, adverse birth outcomes, suicide and homicide rates reduced. In our own research that we conducted last year between October and November in 2016, we collected responses from around 1,000 young people under the age of 18, asking them about their perspectives about alcohol, and majority of them actually believed that there needs to be better regulation of underage access to alcohol in Hong Kong, and that was about 61%. And the number one reason why they said that they believed this as young people was because of the easy access to alcohol, and that was their most popular reason. Now, we know from the data that the WHO also provides to us, the evidence, is that poor populations, and especially young people aged 15 to 29-year-olds, may experience disproportionately higher levels of alcohol-related harm, even fatal ones. So on this, that we advocate that this amendment to the bill will protect these disadvantaged communities in Hong Kong, of which we very rarely hear much of. Now, we know also from the data in Hong Kong that the rates of youth alcohol use in Hong Kong are lower than reported in other Western countries. However, we do know that it is very prevalent, and this is something that we've seen, particularly on our outreach work here in Hong Kong. According to the Narcotics Division 2014-15 survey of drug use among students, amongst all covered students, proportions of lifetime drug taking, tobacco taking, and alcohol taking students, the highest one consistently was 56.2% in comparison to the other two, which is only 2% and 7.4%. With this being the most prevalent of all substances being used by young people in this population, this is a concerning point for us, and we would welcome, once again, any measures that would protect young people from this. However, we do agree that, just because you implement a policy, it does not necessarily mean that it's going to remove all issues. There are definitely a lot of things that we need to consider, other implementations that will affect point of sales, that will affect how we provide training. So we go back to the young people. As a youth organization, we went and asked them again, what is it that needs to be done in addition to change in policy? And majority of the young people who answered actually said that they wanted education. And so we hope that this will be considered as part of the work that we're doing.
好，下一位係鍾燕婷。
Next, Ms. Zhong Yinteng. Members, we are working in prevention, and in our experience, we see that the high school students, where they purchase alcohol and use alcohol, this is becoming more and more prevalent. We see them in convenience stores. They gather together, they chat, and they consume alcohol. So they have very low awareness of the harms of alcohol. A lot of times they fall afoul of the law, or they become intoxicated, and they are aware of alcohol consumption. And there are also different advertisement strategies being deployed. They make the consumption of alcohol look fun and cool and stylish, and the packaging also attracts young people to purchase this. So even in the year 2000, we had liquor licensing, and where young people could not consume alcohol in in premises with a liquor license, but young people will purchase alcohol and consume it in different locations. So if we want young people to understand the harmful effects, we need legislation. Our service, we find in the provision of services that the first time they consume alcohol is under 18. So in dealing with drunkenness, we see that alcoholics, they can consume alcohol very easily in family gatherings and other occasions. So to stop it becoming a habit, a lot of times we see binge drinking and the harmful effects of drinking. So this amendment will stop 18 people under the age of 18 from purchasing alcohol. We feel that this sends a clear message to society that we want to protect youth from harmful effects of alcohol. It also helps the social welfare authorities and the medical community to step up their efforts in education. We also want to bring about a positive message. We want the vendors, the food and beverage establishments, the parents, and even the young people, they need to enhance awareness. So they should not consume alcohol at a young age, and if the amendment is not endorsed, and if young people can purchase alcohol easily, and we'll see that this consumption will become more prevalent. It will lead to a lot of harmful effects in society. Thank you, Chairman. Next, we have Professor Chan Mei-lo. I'm happy to share my experience in the front line in the last 5 years. We have served more than 550 people who have been affected by alcohol, and we provided professional services. Some 20% of cases, that is roughly 211 people, they were addicted to alcohol and sought help. So even though 60% of cases are aged between 30 and 50, but some 20% of cases are between 18 and 29. And the age group, the figures are increasing for this age group, and more than 20% of cases, they also have psychological problems. So during the teenage years, they have already consumed alcohol, and they were even addicted. So one of our cases, Akam, he was in his 30s when he approached us, but his appearance, his body had already aged. He had indicated that he had passed out on a beach and was sent to hospital. So after 3 weeks of detoxification, he was now determined to face his drinking problem. And he admitted that at a young age he had started drinking with his parents and family, and the adults, he was also purchasing alcohol for the adults in his family. So when he was 20, he could consume a whole bottle of Chinese spirits, and every day he could consume 2 bottles of 700 milliliter spirits, and that led to organ failure, and he had been visiting the hospital on numerous occasions, and he was emotionally affected, and he even attempted suicide on numerous occasions. From a clinical point of view, and international experience indicates that kids who use alcohol at an early age are more affected by alcohol. So the influence includes an impact on memory, on analytical abilities, social functions, and even brain development is affected, and it might even add to increase the possibility of addiction to alcohol. So we support the restriction of sale on alcohol to minors. So this not only affects the restaurants, bars, and convenience stores, it sends a clear message, and it also tells the public, especially parents, that we need to have more public education. We need to remind the public that alcohol has a negative impact on young people's mental and physical development. Okay, thank you for the deputation's speech. We'll have the government respond later, but before they respond, let me indicate the officials in attendance. The first, FEHD, Miss Yun Wai, and second we have FEHD, Miss Ao Wan Si, and the third we have Miss Ma Ji, and we also have Dr. Chan Siu-Mui in attendance, and we also have from the Tobacco Control Office, Dr. Jeff Lee, and we also have Miss Queenie Wu, Government Counsel from Department of Justice. So, which government official would like to respond first? Miss Yun? Thank you, Chairman and deputations, for attending. Well, actually, my response had already been expressed by the deputations. The amendment proposal is focused on not selling alcohol to people under 18 years of age. So, from our perspective, we are plugging a loophole because premises with LLB such as restaurants and bars, people under 18 years of age cannot consume alcohol there, but in other circumstances we do see underage people where they can have access to alcohol, for example, in convenience stores and supermarkets. So this is not just the only focus. We also need to step up public education. We need to state clearly that we do not encourage young people consuming alcohol. So this legislation has a clear message, and for frontline staff, for point of sales, we think that it provides some assistance. Some people do tell us that they have been undertaking a voluntary approach to not sell alcohol to people under 18 years of age. But we do need legislation to help it to make it easy for frontline workers. So in the future, frontline staff, if they have reasonable doubt, they can request proof of age and decide not to sell alcohol to the person and avoid breaking the law. So under the voluntary system, it's very hard to not sell alcohol. Customers would just go to another store to purchase alcohol. So we do need legislation, and we need to implement the FEHD will also step up education regarding consumption of alcohol. And aside from not allowing the sale or requiring retail locations, they need to have a clear sign saying that according to the law they cannot sell to people under 18 years of age. We think that that can help the frontline staff. Just now we also mentioned that CCTV, if there is a dispute, that can also help the storefront staff to avoid selling alcohol to a person who is not 18. Regarding law enforcement, the FEHD, we will have detailed guidelines for them. So whether it's internet sales, we require the buyer to declare that they are 18 and above. Regarding the delivery, we're talking about sales. We're not trying to target the delivery aspect. So we will have clear description in our guidelines, and we are trying to target the sales. At this stage, we would like to amend the law and plug a loophole, and we'll see if we need other measures to step up the control.
秘書長。
Thank you, Ms. Yun. And we have two members, Dr. Kokaki and Mr. Andrew Xu, would like to speak. This section went to 3:15, maybe 4 minutes each with Q&A. So you're free to ask the deputations or the government officials. 3:15 till. And thank you for the deputations today. We heard from the Deputy Secretary. Those present, including myself, are supportive of this amendment. The biggest issue, 2 points. Is there any way to ensure that we adequate enforcement? I'm learning from the indoor smoking ban, and the anti-tobacco office does not have the resources, manpower, or the budget, and didn't get to the satisfaction we wanted. And we don't have an alcohol control office. So in the future, will there a designated team for this? Secondly, is there that you can delegate the powers to other departments such as the police to enforce this? And how you go about this, and what is the size of the team? Otherwise, this would be meaningless. And also, on terms of publicity and education, the tax of red wine have been reduced. I objected at 10 because you encourage more drinking. It's more to do with underage drinking, because drinking affect all demographics. For those over 18, that I don't need to speak further in terms of the damage it had done. I wonder if the government had any plans to attempt to rectify the situation. Is it time to reconsider, or probably what's the direction of taxing them? Who have I would like to ask for on the third figure, and on the cost we paid on medical, or the loss of working days, or the social cost of drinking. There's not the small amount of wine duty collected is not fair. A health department can provide me with the figures afterwards. In terms of the social cost of alcohol abuse, if there are no local figures available, can you take reference with overseas figures so the deputations would know the scale of the damage? So there are 3 questions altogether. Deputy Secretary or any other person? Dr. Chan Sium Wei. Thank you, Dr. Kwok's question. In terms of manpower, the Department of Health has planned, and once these amendments had enacted, to lobby resources from the government in setting up an inspector team. And it would take reference with the enforcement experience on the Tobacco Control Office. And it will also consider where there will be shared resources. And how many persons would you had in mind? As we need to lobby for resources. So how many persons do you have in mind? Do you have an estimate? You can't tell me like only a few though. How would that work? We'll apply for funding according to our program. So can you supplement this information after the meeting? Sure. Dr. Kwok also asked, in terms of public education, the Department of Health, alongside in terms of the ills of the alcohol abuse, had work in continuing. Back in 2007, in primary school, we had some education work targeting those in primary 3. We have a program called the Health Pioneers in teaching them the consequences of alcohol and tobacco. And in secondary schools, and since we have this adolescent youth service where we would dispatch staff to our staff to conduct thematic talks and workshops. And more recently, at the beginning of since still late last year, we have a alcohol-free youth program. As we are concerned to provide legislation, we hope the public, especially the parents and the school, to join hands and cooperate in order to protect the youth. And since late last year, we have some joint workshops with schools and parents, as well as launching some promotional clips and have meetings with school principals. And coming up at the end of this year, with the medical professionals, we plan to launch a screening or a short intervention measure, and hope that the medical professionals help to screen those vulnerable to alcohol, where early intervention should be carried out. Do we have time for the third question? Or maybe just briefly? Maybe save for the second round, as your time's up. Mr. Andrew Hsu. I am the representatives for the wholesale and retail sector, which wine merchants is one of my constituents. I noticed the more regulations we have, it could be obstructing to business. Does that mean that I would not agree to this amendment? I said that as an upright gentleman, we hope to make money by the right way. For those underage, selling alcohol to them, is that something that the sector and trade they wanted? I haven't heard anyone that they wish to sell alcohol to the underage. Whether alcohol is good or bad, I think the public has an opinion. I think the adults should be able to make their choices. For those who are underage, do we afford them the same choices, especially when they're still immature? We disagree as well, and this view is shared by the trade. And for this proposed amendment banning the sale of alcohol to minors, I supported it. I've asked the trade to come to today's meeting. That means that their opposition is not that great, because they hope that the adolescents could be protected. I heard the Lion Rock Institute representative in stating that referring back to the 1920s the prohibition in the U.S. It was asked for a alcohol ban. I'm sure that the Hong Kong public would be quite opposed to it. As for the underage drinking ban, I think this is not quite uncomparable to the 1920s prohibition. And there was some question raised by deputations, if they were rather technical in nature, that have been mentioned in the past. For example, the sale of alcohol online. So what happened with the delivery or receiving them? Were there any difficulty in enforcing them? Or what happened to the frontline staff? The purchasers could look overage, and there will be a dispute. How about the posters and so on? I wonder if there are any proposals or any solutions proposed by Department of Health. Ms. Yun? As for whether someone would have looked quite mature, maybe there might be reasonable doubt that in refusing and selling to them, because this scenario will likely to exist, and if the shop staff would have reasonable suspicion, and even on our staff making the inspection, we came across this kind of case as well. And this is the same practice adopted for the selling of tobacco. If we appears to look have suspicion and doubt, you have the right to ask for the age proof of age. We always stressed it upon the enactment of the law, and for the alcohol selling places, there will be a clear sign stated that you're not allowed to sell alcohol to underage. That we believe to be helpful. And the Department of Health has just mentioned that in terms of the highlighting the consequences of alcohol, and once the underage drinking ban is implemented, we hope that we have stronger grounds for application. How about the online sale? Last time there will be a question on the delivery of alcohol. We don't plan to target, like for example, so if it's just on the delivery business, we don't plan to catch them. And in our current amendments, tend that the age is not included those in delivering them. As for how do we further clarify that, and how do we deal with this sort of situation, and how do we prevent them from breaking the law? So we can take a look at the wording, or take up any suggestions from the trade. So, Dr. Kwokaki has still a third question. Do you have? I'd like to supplement. Oh, she haven't answered with the figures. Maybe 3 minutes. Question and answers. Oh, problem. So Hong Kong U has a smoking survey. As we recall, the figures as around 59 or 6 point something billion. However, the alcohol should be just as prevalent as tobacco. For example, the economic loss due to drinking in some social and health costs could be quite enormous. Of course, I hope that the Department of Health can provide me some figures. If not, I hope that you can engage a consultancy or conduct some survey to tally up a figure so that the public will be aware of the cost we paid. It didn't necessarily would be those under 18, and we do not agree that those over 18 will not have a problem drinking. Dr. Chan, as for Dr. Kok's question, from what we know, the scholars in Hong Kong have not done a wide survey on. what we have those hospital authority specialist clinic, and for those who hospitalized or death due to alcohol, as Dr. Kwok may aware, that is only tip of the iceberg. And as for your suggestion, we will give it further thought. So what? Sometimes we have a lot of research fund by the government. Maybe you can consider. You should get on with this as soon as possible. If you'd like to have some more concrete figures in telling the public whether under or over 18 they should not engage in excessive drinking or not drinking at all, this is important to provide a figure. I mean, a lot of scholars, especially the two medical schools, are willing to carry out this research project. So what is the government's stance? Would you consider this? So can you give us some undertaking, Deputy Secretary? So when will we look into what could be done? We look at those cases of alcohol seeking help in hospitals. How they might be classified under alcohol causes? Maybe there may not be a clear classification. So I need to take a look at what we can do to produce some meaningful figures.
Mr. Xiu Gafei. Now, in my recollection, red wine is tax-free, but for other alcohol, is there a tax? If there's a 30% alcohol content, they have to pay tax. So alcohol content that exceeds 30% is taxable, is dutiable. Well, I'd like to follow up on Dr. Kwok. Alcohol consumption. Some people say that red wine is good for you. Well, I don't think alcohol is good, but Hong Kong public have their freedom. So after 18, they should be able to choose. So if you were to restrict their freedoms through tax, well, I don't agree. Why should Hong Kong people have less and less free choice? But Dr. Kwok mentioned that the administration, do you have any alcohol abuse studies, negative impact on health? Do you have statistics to show the Hong Kong public so that they can make a better choice? Well, I think that direction cannot be wrong. Dr. Kwok is concerned about public health, and I agree. But of course, how do we balance freedom of choice? That is also important. So you shouldn't increase the tax and hope that people consume less alcohol. But you should remind the public that alcohol consumption, alcohol abuse is bad for you, and you should provide some scientific proof, and I agree with that. Any response to that? Thank you, Mr. Xiu. We will take on board your views. So that concludes this session of Q&A from deputations. We'll continue the next part of our meeting. The meeting has to continue. So the meeting will run to 4:25, and if you don't have any questions, we'll go into clause-by-clause scrutiny. So let's take a 5-minute break. You need to make a phone call. We'll resume at 3:25.